Hi, I'm Christina Kim. I'm a PhD candidate in Human Development and Family Studies at University of Wisconsin-Madison. Today, I'll be talking about caregiving experiences during the COVID-19 pandemic. The COVID-19 pandemic has exacerbated existing stressors and created new stressors for caregivers. For example, the pandemic disrupted caregiving routine and increased caregiving intensity and burden. Caregivers also had to navigate through the limited caregiving resources and uncertainty around healthcare access and decision-making. All of the new added stressors has put a great toll on caregivers' psychological well-being. Caregivers experienced greater anxiety and depression symptoms, greater feelings of stress and loneliness, and also reported being more concerned about their loved ones' well-being compared to pre-pandemic. Considerable evidence suggests that social support from family, friends, support groups, and community is an important factor associated with lower caregiving burden. Given the disruption in social support services during the pandemic, access to such social supports may have differentially affected caregivers' psychological well-being. We used the survey of the Health of Wisconsin data to examine caregiving experiences during the pandemic. The SHOW program launched a statewide online phone survey to examine early and ongoing impacts of COVID-19 on health and well-being across diverse communities and families in Wisconsin. The data were collected across 3 waves during the pandemic. First, in the early pandemic in May 2020, second, during the winter peak in January 2021, and third, during the hot vac summer in June 2021. I'd like to go over some sample characteristics of the overall sample. The mean age of the sample was 55 years, and more than half of them were women. About 1/3 were living with children, and majority of the sample was non-Hispanic white and were highly educated. About 1/4 reported family income over $100,000 per year, and most of them also reported having at least one medical condition and used insurance. From the overall sample, we identified 6% of caregivers who were caring for an adult. Of the parents in the sample, 28% were identified as caregivers of children with special healthcare needs. This is considerably lower than what we would expect based on the population-based data. It may be possible that caregivers who experienced heightened stress may have not responded to the survey. Now we're looking at the breakup of changes in caregiver status among caregivers identified at Wave 2, which is during the winter of 2020-21. About 40% continued to be caregivers, another 40% stopped being caregivers, and additionally 20% were identified as new caregivers. Moving on to caregiving experiences, I'll go over caregivers' experience with COVID-19 and examine how they were different from non-caregivers. First, we'll look at caregivers of adults. In the beginning of the pandemic, about 50% of caregivers and over 40% of non-caregivers felt that COVID was a threat to Wisconsin. Caregivers were also more likely to feel that COVID was a threat to their community and to their household than non-caregivers. We asked the same question to parents. Again, about 50% of parents caring for children with special healthcare needs felt COVID was a threat to Wisconsin and were more likely to say so compared to parents without children with special healthcare needs. However, parents of children with special healthcare needs and parents without children with special healthcare needs did not differ in seeing COVID as a threat to their community and household. About 40% of parents said COVID was a threat to their community, and 15% said it was a threat to their household. On average, caregivers took more precautionary behaviors than non-caregivers. The most commonly endorsed precautionary behaviors were wearing masks, avoiding shaking hands, and practicing social distancing. Now, moving on to coping strategies, we'll see how caregivers coped with COVID-19 related challenges. The survey asked caregivers what kind of coping strategies they used to deal with changes, stress, and anxiety during the pandemic. In the beginning of the pandemic, non-caregivers used more numbers of coping behaviors than caregivers. They were more likely to take walks outside, connect with friends and families, and exercise and work out compared to caregivers. We also found that parents who did not care for children with special healthcare needs used more numbers of coping behaviors than parents who did care for children with special healthcare needs. Again, they were more likely to take walks outside and connect with friends and families. Moving on to caregivers' psychological well-being, we'll look at how caregivers' mental and emotional health changed over the course of the pandemic and see whether they differed from non-caregivers. First, starting with stress levels. The blue line represents caregivers of adults and the yellow represents non-caregivers. Here we see that caregivers experienced higher levels of stress throughout the pandemic, and their levels of stress were consistent. On the other hand, non-caregivers started out lower in spring 2020 and had a peak in winter 2020-21, and then decreased to similar levels as in about a year before on spring 2021. Again, we see the same pattern for parents. Parents caring for children with special healthcare needs experienced higher levels of stress than parents who did not care for children with special healthcare needs. And here, both of them experienced a peak in stress levels at winter 2020-21. When compared to stress levels to non-parents, we see that both parents with or without having a children with special healthcare needs experience considerably higher levels of stress. We also looked at stress levels by breakout of caregiver status and examined who were most vulnerable to experience stress. As we see here, new caregivers and ongoing caregivers were most at risk of experiencing greater levels of stress. This was also true for parents caring for children with special healthcare needs. New and ongoing parents of children with special healthcare needs experienced greater stress. We also looked at caregiver burnout. On a range from 9 to 34, caregivers of adults experienced moderate levels of burnout, and the levels of burnout increased over time. Parents with children with special healthcare needs experienced higher levels of burnout, and it also increased from winter 2020-21 to spring 2021. These levels were considerably higher than parents who did not have children with special healthcare needs. Finally, we were interested in whether social support, particularly neighborhood support, buffered caregivers' levels of stress. The blue line represents caregivers of adults and the yellow represents non-caregivers. For both groups, caregivers reporting lower sense of neighborhood community had greater levels of stress. But these differences were minimal with high levels of sense of community. This suggests that community-based support was critical in mitigating the adverse psychological outcomes for caregivers during the pandemic. To wrap up, we found that caregivers and non-caregivers differed in how they responded to COVID-19 related challenges. Caregivers experienced considerably higher levels of stress than non-caregivers. And this was also true for parents. Parents experienced higher levels of stress than non-parents, with parents caring for children with special healthcare needs reporting the highest levels of stress. Also, caregiving burnout increased over the course of the pandemic for both caregivers and parents, and neighborhood support mitigated the adverse psychological outcomes for caregivers during the pandemic. Thank you for listening. If you have any thoughts, questions, please reach out to us and we'll be happy to answer your questions. Thank you.